Have you seen this type of skin infection in your children and you're wondering what it could be? Is it contagious? Will it go away on its own? What treatments will I use? In today's video, I'll be teaching you all you need to know about this skin infection. This is called Obu in Igbo language, and I don't know what is called in other languages. Please tell us in the comment section. Before we continue, click on the plus sign to follow, subscribe, like, comment, and save to watch later and share to your family. Let's go. Impetigo is a common and contagious bacterial skin infection that mainly affects children. Adults can also have this bacterial infection. It is caused by Staphylococcus aureus or Streptococcus pyogenes, or both of them. It is represented by red blister or sores that eventually ruptures to form a honey-colored crust. It appears in places where there is broken skin, that is the mouth or the nose. What are the symptoms of this impetigo? The first thing you will see is red sores or blisters. So this may be the first thing that appears on the skin that has fluid inside. The next thing you will see is a honey-colored crust. As these things that have fluid inside burst, they leave behind a thick or golden crust on the skin. The third thing you might experience is itching. The affected area may be itchy, although this itching is less severe compared to other skin conditions such as eczema. You know, eczema can be very itchy, but in this case, this skin condition is less itchy. That is what it is trying to explain. Then causes. The causes of this impetigo, the first cause is bacterial infection, like I've said earlier. Impetigo is caused by Staphylococcus aureus or Streptococcus pyogenes bacteria, or the both of them can cause these symptoms at the same time, which enters the skin through a cut or insect bite or other breaks in the skin barrier. So this is how this infection enters your skin. Another way it enters is close contact. The infection spread easily through close contact with an infected person or use of contaminated objects such as towel, clothing, or toys. What are the treatments of this infection known as impetigo? The first treatment is use of antibiotics. These antibiotics can be in form of creams that you can apply or oral antibiotics, and are typically prescribed to eradicate this bacteria that is causing the infection. Then the next thing is hygiene. Keeping the affected area clean and dry can be very important to prevent the spread of this infection. So hygiene is very important in the treatment of this infection. The third one is avoid scratching. I know it can be itchy, but avoid scratching. Encouraging your child to avoid scratching the affected area to prevent the further spread of this infection, because this thing has fluid. Once you are scratching it and it ruptures and touches another place, it starts to grow again. The next step of treatment is isolation. That is separating the children that have this impetigo from the others that does not have this infection. That is separating their belongings and everything that they use in order to prevent them from coming down with this infection. So in this video, I'm going to tell you the misconception or the misinformations that people have about this impetigo. The first misinformation is that impetigo is caused by poor hygiene alone. Impetigo, why poor hygiene can contribute to the spread of this impetigo. The infection is primarily caused by bacteria that enters the skin through cut and break, rather only on this part of cleanliness. Although lack of cleanliness can cause this infection, but it mainly enters the skin through cuts an open barrier in the skin. Another one people say is that impetigo is not contagious. I've seen mothers say this obu is not contagious. Impetigo is highly contagious, especially when the blisters have burst and the bacteria is now exposed. So any close contact with the person that have this infection or their object that they use can spread the infection. So be careful and be mindful of this infection. The next misconception or misinformation that people have about this impetigo that impetigo will go away on their own without treatment. Hmm. Although some mild cases of this impetigo may subside or resolve without treatment, it is generally recommended that you treat this skin disease or seek a medical advice in order to prevent further spread of this infection to other people. The next misconception people have this about this impetigo is that impetigo is only children that get impetigo. No, it's not true. It is common in children, but it can appear in people that have low or weakened immune system or coexisting conditions. Maybe all those people that have immunocompromised diseases, you can see impetigo happening to them. It is not only in children that impetigo occurs. So, impetigo is a common skin infection in children. If it's characterized by red sores or honey colored cross. So prompt treatment with antibiotics and good hygiene practices are essential for treatment of this infection. So if you have anyone or child that have this skin infection, please do well to consult a medical personnel, at least to prevent this skin infection from going from persons to person. So thank you for watching today's video. I hope today's video was helpful to you. If so, like, comment, share this video to your loved ones, and see you in my next video. Thank you.